patients that present to the clinic with shoulder arthritis, typically bone on bone or maybe an old rotator cuff tear that was never treated, are usually candidates for operative intervention if they failed all conservative treatment, which would be anti-inflammatories, physical therapy, maybe injections. So when it comes to shoulder replacement, there's really a couple of different types that we do. There's the standard shoulder replacement where we basically will put the ball where the ball was, put a new ball in, and put a socket where the socket was. That's kind of a conventional standard shoulder replacement. Great operation, it's been around for a long time. Relatively new development in shoulder replacement, and it's not new anymore, it's been around for decades now, would be reverse shoulder arthroplasty. And patients always ask me, what is reverse shoulder arthroplasty or reverse shoulder replacement? And that's where we basically, if you imagine, this is where the socket used to be here, and we're basically putting the ball there, and where the ball used to be, we're putting the socket. So the advantage to that operation is it allows your big muscles like your deltoid to take over for a deficient rotator cuff, because it pushes the center of rotation further out and then allows your big muscles to move that arm bone, and so the recovery seems to be a little bit more complete. When I do a reverse shoulder replacement, I actually take a CT scan of your shoulder and I recreate a three-dimensional model of your shoulder blade, and I can actually plan the operation on the computer, and then I have a guide that comes that is specific to your anatomy, which is kind of a cool way of doing it and make sure I get the socket in the exact right position, or at least a position I planned it. So it's a pretty good recovery, much like hip replacement, where you wake up the next day and you're like, gosh, my shoulder feels better. You know, the hip, shoulder, they get better so quick, which is kind of a great feature of the shoulder replacement.